gender transition procedures are very unusual in that society has not figured out how to categorize them yet. Okay, because on one hand, I would argue these are equivalent to cosmetic procedures. It is changing the aesthetics of your appearance in order to look different, okay? But the way we are treating them in the medical world, in the therapy world, is that they are like a medically necessary procedure that insurance is going to cover. And in order for insurance to cover it, you have to go through almost this checklist. So therapists are in a super weird position in that when you want a letter for mastectomy, for example, let's say you're a girl who identifies as a boy and you want to get your breast removed. In order to go to a surgeon and have that done, unlike a cosmetic procedure that if you want a breast enhancement, you just go straight to the surgeon and do it. For this, you have to get a letter from a therapist. So the therapist is this bizarre gatekeeper who is making recommendations about medical interventions, even though they're not a physician. And they're also told that they have to use this affirmation protocol where like every patient gets what they want. So it's like a super bizarre situation to be in. And so I think from that perspective, therapists absolutely should be held accountable because the therapist is the person who's green lighting this entire medical process, which is weird. Like, I can't think of any other situation as a therapist where a person would come to me and say, hey, I want a nose job. Can you write a letter saying that I should get one? Or like, I want a divorce. Can you sign this document saying that I'm in the right mind to get a divorce? Like, there's no other situation where we're asked to write off on stuff like that, right?
Yeah, I'm going to butcher this term. I'm sure you know what I'm talking about, but it's a form of body integrity identity disorder, omniphilia. I don't know if you can...
Potemnophilia,
yes,
I'm pretty sure is how it's said.
Yeah, so yeah. If I go to a doctor or a therapist, I say, this arm, I don't identify with this arm doesn't really belong to me, I would like a surgeon to remove it. There is no place where that would be taken seriously. That is a mental disorder, you need psychotherapy. But if instead of arm you said genitals, all of a sudden we put this into a different category, right? Again, this comes back to like this issue is holy and sacred and it can't be held to the same standards of evidence.
Yeah, it's really crazy and interesting. And I mean, that's why my perspective is that I think this should really be treated like a cosmetic procedure, and it should be, I think, like, if people are grounded in a realistic understanding of this, everyone will be better off.